¿Sabe cómo se llama la mamá de Camilo VI? ¿Cómo se llama? Mamá Cesta.
I would say that the main difference about yoga and yoga therapy is like this person's coming to you because they have an ailment, and it could be that they are having a knee problem, or that they're having anxiety, they're having depression, and they're coming for you, and that's the intention is to maybe manage that or help heal that. And yeah, yoga can be very helpful. It doesn't mean that it can cure everything, but it kind of goes deeper into the root or the causes of it, and it looks at the individual more from a holistic level. So sometimes our physical symptoms get manifested because of something else that's going on inside of us in our brains or in our emotions. So we're not doctors, and we're not trying to be doctors at all, but it's having a little bit more knowledge in the sense that of why things happen or how you can help that condition. Looking at the person holistically from the physical to all the koshas, like all the levels of being, right? All right, continue. Yoga teacher. Belen.
Me? Yeah, there are the yoga teacher. There are substantial differences between yoga teaching styles. Some teachers focus primarily on instruction, guiding students through their practices and helping them to practice correctly. The scope of instruction can range from asana to pranayama to meditation, but fundamentally, instructors using this style will guide the student in their practice. Other teachers seek to educate their students on in how to practice rather than or in the midst of guiding the practice itself. This teaching style empowers students to guide their own experience, whether they are practicing alone or in a group setting. In either case, good teachers are able to choose appropriate practices that meet the interests and abilities of their students. Whether their style is instructional or educational, yoga teachers focus on teaching the various yoga methods in a correct and appropriate way. The yoga therapy. You want me to continue?
Uh, okay.
The yoga therapist,
Mhm.
rather than focusing on yoga methods and practices, yoga therapists fundamentally focus on their clients' needs. Their job is to understand why their clients have come to see them and determine what they can do to support them. To help them in their work, therapists are trained to assess clients through listening, questioning, observing, and appropriately touching. Therapists look for ways to help their clients reduce or manage their symptoms, improve their function, and help them with their attitude in relation to their health conditions. After assessing clients, therapists establish appropriate goals, develop a practice intervention, and then teach clients to practice that intervention. In this sense, therapists choose yoga techniques in relation to how they will specifically benefit individual clients. The yoga class.
Wait. So let's just make a stop. So basically, yeah. So when we do a yoga therapy session, so the difference is we're first gonna do an assessment, and this is something you may do as a yoga teacher as well. But you do an assessment on why is this person here, what is really troubling them, and if you were going to maybe target one or two things, what would it be, right? In according to their goals, right? So you're gonna do an assessment, and according to that, so you're gonna fill out an assessment form where you're gonna find out some information. You're gonna have a conversation with them. Very important that you see them, that you see how they express themselves, how they're like how they're breathing when they're talking, because that tells you a lot about the person. Even the words that they're using to communicate things are things that will give you cues, right? And you can make your notes. You don't want the person to feel intimidated either. It's more a conversation. Sometimes when you ask too many questions about their medical history, it may be intimidating to them because they think that you are going, you're giving out this information that's maybe private. So you kind of have to have a balance. You want to know enough, but not to the point where they're feeling judged or that they're feeling that they're also very important the HIPAA training. So this information is always confidential, always confidential. Go ahead, Bring.
Um, in the previous section, it talked about like teaching your style being instructional or educational. Do you like agree with that? Or, and do you like, can you kind of help me understand that?
So I would say from what I understood, the instructional is more like how you really practice correctly, meaning you are doing the poses specifically as they need to be. And this is more, I would say, like an Iyengar teacher or even an Ashtanga teacher, that they're focused a lot on form and being able to do the exercises as they were designed originally, right? And maybe not flexible enough as the other one. I think finding a balance between the two. The other one is more about guiding the students find their own way of practicing, but it is always important to pay attention to the form, because that's what you're there as a teacher for, right? If they're practicing something incorrectly too many times, they're going to create issues in their bodies. So for me, the best way is I want to empower my students for sure. Like, I don't want to always have them rely on me. I want them to find their own power. But how you do it is, I would say, a mix of both. How you do the exercises correctly will help you, because it is body alignment, right? It is important. That alignment is important, like that your spine is straight. It's important that your body's balanced. It's like the highest or the dense aspect of it, but I think it is important, right? And even with other aspects like non-violence to yourself, those kinds of things are still instructional, I feel like. But I would say I want to empower my students. That's how I feel. And I want them to find their own way of teaching. Like, I teach you what I know, and with what I know, hopefully it'll help you create your own style.
Yeah.
Does that answer the question? So, okay, so let's continue. So I'll continue. The yoga class. Yoga teachers may offer a variety of yoga classes, including classes for individuals or groups of people with specific conditions. Common examples include yoga for pregnant women, yoga for heart patients, and yoga for cancer survivors. In these classes, good yoga teachers must learn the contraindications for working with people that have these conditions and respect those contraindications while teaching the students appropriate yoga. The intention in these types of classes is to teach the students how to practice yoga while respecting their health conditions. So again, there's a little bit more of that. So when you get deeper into yoga, maybe you'll find your own niche, right? So maybe you'll be like, okay, I only want to focus on yoga for pregnant women, or I only want to focus on yoga for joints. And that's going to be your specialty, depending on what it is that you like. But important to always learn about the contraindications, what you can or what is or not recommended. Or if you don't know, tell them, please ask your doctor if you know what you are allowed or not allowed to do when you do practice yoga. All right, so Rain, continue. The yoga therapy session.
The yoga therapy session. The intention changes in yoga therapy sessions for individuals or groups with specific conditions. After an appropriate intake and assessment, therapists will often focus on the specific symptoms that trouble their clients and identify methods to help them manage those symptoms. Examples include helping clients with pain management, fatigue, or sleeplessness. In addition, the therapist's role is to empower clients to take a more active role in their self-care. The therapist's job is less about teaching yogic techniques and more about helping clients to overcome their challenges and gain independence. Hence, the job of the therapist represents a different focus, a different type of education, and a different skill set.
Right, so I think this is more about what you were saying about empower. I think you do want to just guide them to empower, like, even, okay, these are the things you can do. And maybe they come to you when they cannot go any farther, right? But definitely our role as teachers, and I would say, is to empower our clients to take care of themselves, right? Or to manage their conditions.
And this like makes sense the way they distinguish, because like here they're talking about, so I guess to put it in the frame of like yoga teachers and having like an instructional versus educational style or mix, yoga therapists are gonna be a lot more educational because they're focused on the specific person. Okay.
Yeah. Right.
Do you want me?
Sure. Or Elizabeth, go ahead and read the last one. It's fine.
Okay. Commonly, students report great and even therapeutic benefits from the yoga classes, no matter which type of class they're attending. This occurs because of the inherent therapeutical potential of yoga, but it should not obscure the distinction between a yoga class and a yoga therapy session. Although the distinctions may seem subtle, it is important for the yoga student and the yoga therapy client to be clear about their intentions when seeking out yoga professionals. It is also extremely important for yoga professionals, whether teachers or therapists, to be clear about the intention and orientation of their work, honest about their level of training and understanding, and realistic about their skill sets. Although both yoga teaching and yoga therapy are valid and valuable professions, they are different. It is important that we, as the yoga community, become clear about these distinctions.
Right. So mainly it's about, okay, what is it? So it just should be clear what the difference is between yoga, just a regular yoga and a yoga therapy session. Does that make sense to you guys? Do you have any questions or any comments?
No, this goes along well with like what we did in business with yoga, like or the articles that we read. Like it's one of the articles like one of the people said that like that not knowing enough can endanger a person. So you always have to like always remember like your limitations. And I think that's why the shala is great because Melinda said how when you get into the yoga therapy program, you have all these other protocols that have been used for certain conditions, and you're able to learn from that. So that is a further more educational kind of path. So I always emphasize that it's very important because I have Marfan syndrome, the heart condition. So like I shared before, I was always getting frustrated that sometimes I can't do certain things how other people can do them. And that's always been like my battle. But having a good yoga teacher, it's really important. Like when I had the first two teachers that I've ever had, they did notice and they asked me questions, and they changed the complete class to not make me feel left out. But that's because they were so well trained that they're able to do those changes, and it made it seem so like I felt part of it. So it's good to like have like a level, like understand your limits, but also it's good to have a good teacher when you have a lot of conditions.
Yeah, and even as a teacher, because I do think that a lot of people experience, okay, I finished my yoga teacher training and I'm going to go teach a class, but then they feel that they're not ready enough because they don't, people will come to them and be like, hey, I have this pain here, or I have this pain here. What exercises should I do? And maybe you're not maybe ready to answer. So just so you know, you always say, first of all, we're not doctors. Second of all, maybe you do know some exercises that will help your condition, but if you don't know, it's okay to say you don't know, or like you look into it, right? And also very important to always ask your students, whether it's yoga therapy, ask your students how they feel, just to bring that sense of awareness. And also, like, do you have any conditions that I need to be aware of? And maybe if you don't know, you're like, if you feel like you're doing something that feels like you're hurting yourself, please just stop doing it. And it's just that self-awareness that will help them, guide them, because when you're going to do something that's going to hurt you, right? Like you have that sense. So just guiding them in that way, and saying, one of our main values is not non-harm to yourself or others. So just be careful, not because the person next to you can do this pose means that you have to do it the same way. It's not a competition. It's really about you and how you get a little better each time, and it takes time, right? So just being mindful and not of those things. And if you don't know, it's okay to say you don't know. You don't have to know everything. Yeah. Anyway, so we're gonna continue with the article of asanas for ailments. So this was an introduction. So again, so yoga can be used to help manage specific conditions, and then we're gonna talk about some of the conditions here, and there's a lot of them, but at least we're gonna talk briefly about a few. So, Belen, do you want to start with asanas for ailments? So it should be your first article on chapter 6.
In chapter 6? Oh, okay. Asanas for ailments, right?
Yeah.
That's the first one I have. Okay. Always consult a doctor before you use. Okay, wait a minute. Always consult a doctor before you start. Get a qualified opinion and be intelligent about what you do. Your body is not like any other, and it will not react in exactly the same way as another. More important, it's the only one you have, so look after it. Don't expect instant results, and don't overdo a pose that works at the expense of a balanced practice, or you'll start having problems somewhere else in your body. Finally, there is no point in doing yoga postures for a complaint if you are then going to go and pound your body in the gym as well. Not all of the poses listed below are demonstrated in this book, as it does not set out to be a manual. Refer to any good yoga manual for those you cannot find here. Addiction. This
So
is
wait. So let's just continue. So I'll continue. Addiction. So this is not one to tackle alone. Get a good patient, teacher, and backup from AA or NA. So Alcoholics Anonymous or Narcotics Anonymous. You should concentrate on standing poses, but not those requiring balance on one leg, and headstand and shoulder stand. Avoid back bends and intense breathing exercises. So, I mean, this is something, and then again, like, I want you guys to take this with a grain of salt. Like, this is what this article says. You're more than welcome to go out there and like find other sources. But again, so for example, here with addiction, it's saying that, well, first of all, you always need a doctor. So you're not their doctor. Maybe they're finding yoga as an additional treatment, but it doesn't have to be their main. So they should always have a doctor look at them for whatever condition, whether it's physical, mental. If they don't want to, it's okay, but it is recommended, right? So for example, for addiction, it says to get additional help, whether it's from like a group or a physician or a person, a psychologist, psychiatrist. And it says to not concentrate so much on standing poses, or no, that you should concentrate on standing poses, but not so much on the balancing one leg and the other. I think that's something you build up gradually. So things that maybe are gonna scare them right off the bat, try not to. You don't know the person's coming to you and it's under the influence of something, right? So you also don't want to put them at risk of falling or so you have to really pay attention to the person, like look at their eyes, look at how they are behaving, and then take the yoga practice. We always say we meet the client where they're at. So we're non-judgmental, so we're there to be present with them in that moment, and then we find them where they are. Maybe that day is just about sitting down and like doing some breathing or some light exercises. You want them to go, if they're low energy, you want to meet them at that energy and then slowly take them where you want. If they're very high energy, you want to start with high energy and then slowly take them to a more balanced state, right? So just always think about it that way. All right, continue. So backache. Who's next? Rain.
You said.
Yeah.
Okay. Lie flat on the floor with your legs bent up and give time to just breathe and relax. Put cushions under your head or legs up onto a chair. Put cushions under your head or legs up onto a chair. All standing poses except the twists, such as triangle, can help. Tree, forward bend onto a table, warrior, and eventually a shoulder stand with the help of a chair wall.
Yeah, so some suggestions for backache, especially like you'll find a lot of people with low back problems, and again, this is all based on mostly caused by bad posture. But again, just lying on your back and also bending your knees. Sometimes when you have your legs straight, you feel that tension because you're creating that arch in the low back. So when you bend the knees, it kind of feels more comforting. Anything that helps you flatten the back or the low back will help ease a little bit of that pain. All right, next, Elizabeth, constipation. Also, so yeah, one note is like for backache, just avoid at the beginning the twisting, because you know there, especially if you don't know what their issues are, but you may aggravate the problem. So just avoid that at the beginning. All right, continue. Constipation.
Yes. Constipation. Over-prepared and over-refined foods combined with stress and lack of exercise often leads to constipation, which itself holds toxins in the body and undermines the whole system. Several cycles of salud to the sun can deal with constipation very effectively. Falling diet, try lots of shoulder stand variations and plow.
Right. So really for constipation, there is so much in yoga for that. We do a lot of, so the twists are really good because it kind of presses a little bit into the digestive system. Also, anything that you're like bringing the knees towards the chest, anything that compresses on your lower abdomen, forward folds also, and keeping that awareness in that area of their digestive system. I think one very effective one is even tapping the abdominals area. So tapping and the pumping the belly, pushing out and in. So that's kind of like massaging your internal organs and really helping you move the energy there. Also, when I find somebody with digestive issues, I will have them at the end, like when they're maybe doing more restorative on the left side, so that circulation comes more towards the left side. So the left side is your colon is on the left side, your stomach's on the left side. So it's kind of bringing that energy or that more circulation towards that area and helps soothe the condition.
Yeah, Melinda shared that I did the Ayurveda,
Ah,
and so she shared this breathing technique, the 21 breath. So she had that one's pretty cool.
what was that one? I don't recall.
It was like 21 breaths, and you're opening. Can't remember exactly what it was, but yeah, and then you go on your left side and you do like 21 breaths, front 21, right 21, and like 7. I don't know, but it's like a ton of different breathing that you do, a lot of breathing on different sides of the body, and it massages everything. And that one's for constipation. I think she shared it for. So a lot of breathing to like, I think to like relax the muscles and open, you know.
That's interesting. I never done that one before. So maybe let's just stand for a moment. We'll take a stretch. What do you guys think? So maybe let's find a pose or, well, let's for constipation, right? So each one can teach one. So I'll start. So open your feet, hip distance apart. Inhale your arms up. Interlace the fingers. Stretch all the way up. Maybe bring the hips forward, the arms back, like you're waking up, and twist to one side to the other first. Just noticing your body. And now exhale, fold forward. So fold halfway. So not all the way down, but like right here. Feel the stretch in the back of your leg and slowly come all the way down. Relax the head. Maybe shake your brain a little bit. Inhale to the nose and then exhale to your mouth. And as you're finding your breath here, I want you to focus your breath on your lower belly, your lower abdomen. So as you inhale, you allow the belly to expand, and you can bend your knees if it's too hard on you today. And then exhale, as you exhale, you're gonna bring the belly button in towards your spine. Almost like you're sucking your belly in. And then inhale, allow the belly to expand into your thighs. And then exhale, relax the head, relax the shoulders, and bring the belly in towards the spine. One more time, deep breath in. Belly expand, and then exhale, belly in towards the spine. One more time in. Feel your low back getting a stretch, so maybe you haven't bent your knees, you can bend your knees a little bit and maybe move back and forth, feeling your balance on your feet, keeping your head relaxed, your shoulders relaxed. One more breath in, expanding the belly, and then exhale, bring the belly in. And then slowly pushing the feet into the ground, you're gonna roll up one vertebrae at a time. And then exhale out to your mouth. Good. Okay, so Rain, can you find me or something that you think would be you would teach for constipation?
You want me to show you something good for constipation?
Yeah, or any of the conditions that we mentioned. So addiction, backache, constipation.
Okay. Okay. Well, we can do plow for constipation.
Okay.
So you want me to do it or like,
Go ahead, guide it. How you would
Okay.
guide it. It's okay, it's just practice.
okay. All right. So let's start seated on the mat. And I'm sorry, y'all can't see me. I was not prepared for being seen like this. Let's see, how do I normally do this? Okay, let's just lay onto the back. So bend your knees and hold under your knees. And then gently round the spine down onto the mat.
We can't see you disappeared.
Okay. And we're gonna place the arms by the sides. Release your head to the mat. And let's extend both legs up to the sky, flexing the toes towards your body, lengthening through the back of the legs. And then we're gonna slowly bring the feet closer to the head. And I really want you to plant your shoulders and your hands down on the floor before you lift your hips up and send your toes to the ground behind you. Once you feel stable here, you can bend your elbows, placing both hands on your back to support your spine, making sure that the most of your weight is resting in your shoulders and that your neck feels comfortable on the mat, not strained. And here, you can try to lift your hips higher to the sky. With your toes tucked on the mat, reach your heels back. You can always bend your knees a little bit if that feels better for you. Or you could try to straighten your legs. And when you're ready to come out, let's release both hands to the mat. And then exhale and gently roll one vertebrae at a time. Lift your feet off the ground, letting your spine come back to flat on the mat. And now let's bend both knees, taking the hands to the outside of the feet and finding happy baby pose. You can rock side to side. When you're ready, releasing your legs, maybe taking hold of underneath your knees and rocking back to a seated position on the mat.
That's beautiful. Yeah, that's great. Perfect. Yeah, I think that's a really good one for constipation, for sure, because it definitely presses onto your abdomen. I did see, Elizabeth, that you were not able to do plow. So is there any way that you would like help us modify it?
I couldn't do it because my of like the pressure.
For the cramping.
I'm asked,
Those are the
but I don't think I can. I don't even think I can do it either. Like it stresses my back too much
got it.
to be able to do
this?
it.
What about just
I got a cramp.
this thing
Why?
I think
here?
holding it. I think holding it there would be, yeah, it might have been like a moderation. I just didn't think about it.
Yeah. No, it's just a suggestion, like for us to know, basically how you would modify it for yourself. Like thinking about the condition, which is constipation, right? Like maybe just staying here, like bending at the knees and pressing slightly on the belly. I don't know how bad your cramps are, if you're even able to do this.
Let me
But
see. I'm able. Yeah, I was able to do this at the end.
And what I just thought we could do, put a bolster underneath the hips, and then you get that, still you get a little bit of an inversion.
right, yeah, that's a
Oh
good
yeah, or even a block.
block. Yeah, that's
Oh,
Yeah.
yeah.
definitely like a
Pretty good.
supported
Yeah.
supported shoulder stand would be a good way to do it.
I used to be able to do it, never perfectly because my belly is too big, but now every time I do it, I get a cramp in my upper belly right here. I try to do it twice. I did it. I got all the way, but I get a cramp. I have no idea why.
Yeah, I mean the cramping is more about getting it's just tightening up because it's not used to getting that being in that state. But I think that for cramping, the best way that you can do it to relax into the pose, right? So just allow to relax, just focus on the breathing basically. So this is like a good modification for sure, Rain, like you said. So using the both it feels just very nice and cushioning. Even like a block or whatever. So it does give you like that aversion, and then maybe it just helps you with the circulation in that area. Good one. Okay, so let's see, Elizabeth, you want to pick one of for backache or addiction or constipation?
Let's see. I'm trying to find the one that I had here. I guess we can all do bridge for the back.
Okay.
Hold on, I'm trying to get back here.
So when you bridge for the back, so I don't know.
Yeah. Would that work? Because that's what I do. But I do it gently. Like I build up to it, like a very nice warm up. Like I start off just like slowly raising the hips with the breath.
So
or
you feel
even
that helps you with backache?
yeah, for me it does. That's usually what I do in the morning and at night after my shifts and before my shift.
No,
Yeah.
But
I also bridge for back pain to like strengthen the muscles because I'll do like some more releasing, relaxing, but then also to kind of like activate the muscles and then release, and that back and forth typically helps my muscles come back to
got it.
lift.
Interesting. Mhm. Okay, so let's do that one then. And you can always be
okay.
supported as well. Mhm.
And you can also put a block underneath. I found out you can leave the block there and then just take a couple breaths while you're on bridge. So let's all go on our backs. Gently lay down, position yourself. And let's make sure that our feet are flat on the ground, on the mat, supported. And try and see if like you can even out both of your feet so they're like the same distance from your buttocks. And here, let's just take a couple of minutes just to notice maybe our body on the mat. If you notice that the right side or left side is more heavy, just balance your body. Let's take one breath here. Breathe in and gently let out a sigh. And then with your palms facing down, we're just gonna slowly raise the hip. We're gonna warm up to the bridge. So we're just gonna do a very gently lift and then we're gonna lower. So we're gonna breathe in, lift a little bit, and exhale and bring our back down. And another one, bring it a little higher and exhale the back down gently. Then one more, let's lift it up a little higher than before and exhale down gently. And just notice, and the next one we're gonna do, just notice how your feet are supporting the mats and you're not giving too much stress to your back. So let's inhale and lift a little higher. Noticing our feet on the mat and exhale down slowly. And let's inhale again up. Try to raise a little bit. And here, let's just hold it for 2 breaths. And on your second exhalation, bring yourself down 1 vertebrae at a time. And now we're going to do it again. Let's inhale up to that same height. Raise it up a little bit, as much as you can. If you want, go ahead and grab the block and put it nice. I mean, I know you guys might be a little bit higher, but if you want, just place it down and go low. And just leave it there for like right under the buttocks. And let's just take a couple of breaths here. And take 3 more breaths. And after the 3rd breath, you can go ahead and remove the block and lay back down on the ground gently.
Perfect. Okay. Awesome.
Yeah. And you can also, once you're here, to notice the effects, you can just open your legs a little more and let your knees touch. And then just notice that centering of the spine on the yoga mat.
Mhm.
And go ahead. And I think we're done. So you can just slowly, gently bring yourself up.
Great, that was great. I loved it. And yeah, and see, like I guess for me for back pain, I use more because my issues usually low back as well. More like bringing the knees in, that type of stuff. But interesting that for you guys it helps, and even for future reference, you can do a little bit of both. More like the relaxing, but also the strengthening is so important, right? For sure.
Yeah, for me, it helps to warm up to it. Like doing that warming up to it or even just bringing the knee, like getting a starting point of bringing the knee towards the chest and just getting the hips warming up a little bit, and then moving to the slowing into the bridge.
Beautiful. Okay, Belen, your turn. So pick one where there is something that works for you. It doesn't have to be what's on here, but something that works for you, or you think that works for those conditions. The first three. So addiction, backache, or constipation.
Backache would be the most, you know, the usual one. I'll try 3. 3. See if I remember. Okay. So let's stand at the top of our mats. Well, so you could see I gotta stand in the back of the mat though. Feeling number 11. Okay. Let's open our palms forward. We're gonna do a samastiti here first. You know, we're gonna do a back bend first. You know, so let's open our palms, lift our arms up and touch our palms. Let's point up and look up and do a little back bend. Okay, let's bring our arms down. We're gonna do tree pose. Let's make sure that our hips are aligned with the second toe, right? Let's lift. Let's put our weight on the right leg and lift our left foot with the toe touching, just to kind of feel your balance. Let's take a breath here. Let's bring our foot up to either the calf, or if you can bring it out to, oops, I can't. Let's bring it out to the thigh. I gotta do it here. Let's bring our hands into prayer pose. And let's take 3 deep breaths here. Look at a point on the floor, like in front of you. If you can, if it's available to you, lift your arms up into a V, like this. Inhale, and as you exhale, bring them back down into prayer pose. Let's bring our left foot down to the ground, okay, to the mat. Let's try the other foot now. Let's put our weight on the left leg, lift our foot, just touching the mat with our toe. Let's focus on a point in front of us on the floor, okay? And let's lift our right leg up to the calf or up to your side if it's available to you. Let's bring, see I can't. Let's bring our hands up into a V if it's available to you. Let's take a deep breath here. And as you exhale, let's go back down to prayer pose. Take another breath. And then let's bring our right foot down to the mat. Bring our hands to the side. So.
Yeah, you did great, amazing. I wanted to say to you guys, so some tips that sometimes
Yes.
helpful, especially because we're talking about specific conditions like backache. Sometimes backache is a lot of times it's caused by like this, like protruding of but like this, like this, and because like your vertebrae get compressed, especially your 4 and 5th. So a lot of people have this habit. So always like bringing the tailbone in or finding that tailbone and having that.
Oh, okay.
You know, even in this pose, you could be like this, and then you could just get Donald Duck syndrome. So always like bringing the tailbone in, especially when we're talking about low back pain. That's a good tip. And the other one that a lot of people do is like as soon as they bring the foot up, their hip goes to the other side. So you feel like they're compensating with their hips. So you always want to make sure that this leg is engaged, so that and then your core is engaged, so that you don't see them like this, because they're basically just compensating, and that will create issues later on. So just things to keep in mind with that part.
Okay. Mhm.
Right.
Okay,
So,
thank you.
but you did great. Good job, everybody. So,
Do you want me to read
go ahead. Yeah.
the next one? I think it was my turn, right?
Depression. Mhm.
Depression. Start working on sitting up straight with your shoulders dropped. All the standing poses give energy and vitality. Salute to the sun, headstand, and back bends are helpful too. As for breathing, do Simasana, Kapalabhati, Kumbhaka, and Brahmari breathing. Eye strain. Staring at a computer and television screens is a constant strain on the eyes.
So
To
wait,
relax them,
let's make a pause. Let's make a pause. So for depression, right? So again, sometimes people are not ready. So they're really depressed. They're not ready to do like high energy exercises. But it's good to know that for depression, anything that's opening of the chest, so opening of the fourth chakra is really good. So any could be back bends if they're ready, but even if you don't do the full back bend, just a slight back bend is okay. Or anything that raises the energy, like Kapalabhati, like breathing faster, it'll bring your energy up, right?
Wonder
But
Woman, micro.
yeah, like opening.
Yeah,
the
that's
chest,
right. Okay.
anything. So saluting the sun salutations is a good way to bring the energy up. It's not to you don't have to strain them as much. It could be like you can start slow sun salutation and then bring the energy up a little bit. And well, obviously inversions as well are helpful because it just gives you like a boost of energy in your brain. Okay, continue. So who's next?
Continue. Oh,
Let's just go one each.
yeah. Okay.
So I'm next, ice cream. So staring at computers, this is a big one nowadays because we are forced to do this so much. We have no choice. So always try to include these types of exercises in your classes, even if it's just one or two. Staring at computers and television screens is a constant strain in the eyes. To relax them, there's nothing better than lying with a compress or rice back across the eyes. The gentle, even way of which releases the tension of the frown, keeps the eyes closed, and blocks out all the light. Some Samukhi mudra is also invaluable for strained eyes. Sit in lotus and close your eyes, then put your hands softly onto your face, thumbs in your ears, index fingers on your eyebrows, middle fingers just below your eyes, the ring finger at the corners of the nostrils, and the little fingers at the corners of your mouth. Have you done that one?
No.
No. Okay, maybe we can do it after.
I don't.
So it's basically helping.
I don't remember. Pretty much closing your eyes with your.
Do
Like
you guys
this.
want to try? So anyway, so my point is anything that's this is not just the only one. This is one that is here. But even like I will do like rubbing their hands and blocking out the light with the palms, and like moving the eyes around like up and down, or like even shutting your eyes tight and opening them wide, shutting and opening, and again like eye circles, blocking out the light. So the blocking out the light is a big one. That's what they sing about the rice bags, and I do have rice bags. I love the rice bags because they're so relaxing. And it just helps, just like the little way just helps your eyelids really relax. And it's also blocking out the light. So once the light enters your brain lights up, right? It's like goes crazy. So so just blocking out the light is not only very relaxing, but it's also very helpful for your eyes. And it helps at night, like you should always turn the lights off, like they say, because that's how your hormones, so your cycle can work properly in your sleep cycles. Go ahead. Wayne.
I had an idea for this one. Like for eye strain, one thing they say is, you know, the 20-20-20 rule, like every 20 minutes for 20 seconds, look at something at least 20 feet away. You could do a practice where maybe it's like a slower practice and you're doing balancing poses and you have to like look at a tree like far in the distance. I don't know, but that would be good to like also in a different way, not as soothing, but in terms of having your eyes work differently and exercising different muscles.
Yeah, that's a great way to do it.
Yeah.
Again, like using the drishti basically. So looking points, yeah. That'd be nice. And then there's other ones like you can use like your thumb and like it's kind of a meditation, but you can like stare at the thumb, even a candle meditation, you can do like staring at the candle, but still for your eyes. For if you have partner, if you're working with partners, you like partner exercises, you can stare at each other's eyes, and this is like very powerful, like in different levels, but it helps the eyes and it also helps you go internally and like it's an experience. I don't know if you've ever done it. We've done it. I've done it a few times, and you just like you can connect to the person like at a heart level too. So a lot of different eye things, and I like your suggestions. If you guys have any other suggestions, because definitely, I think eyes and also like these days, the COVID days, like eyes and anything that's with the hands or fingers. Like I see my kids, I don't know if I told you this, like they're always cracking their fingers. So they have, because they use them so much, like in their computers, right? So it's interesting to see like how we use this so much, but yet we don't pay attention to it a lot. Like we don't take care of it in any specific ways. So
I
just
do
looking
this.
at them to the hands, to the eyes, those things that we take for granted, but we need so much.
Yeah, the neck.
The neck, so
Yeah.
yeah, definitely. That one of the manuals for posture, because I see so many people, and this is something that like really like gets to me when I see people like bending their necks like this, and again they're looking at their phones, they're looking at everything. So this is a habit. This is a habit. Again, I don't know how many years we're gonna evolve to being these creatures, right? And then it's like just like pressing the head. Imagine that you're pressing the head against, or even standing next to the wall and pressing the head back against the wall, so your chin like comes forward a little, and then you're feeling that stretch in your neck. And it's so simple, right?
My sister did a little mini session that I can show you.
Yeah.
If I can. Okay, she said, yeah, the same thing you're saying, like giving yourself, what do you call it? Like pushing your head back, like giving yourself a double chin, you know, and then bringing your chin down a little bit, then slowly, as if you were drawing a circle with your chin towards your right shoulder, slowly, all the way to the back, and then slowly bring it back to center and lift your face. A way to intensify is to hold your hands in the back, and the difference is incredible. So interlace your fingers behind, okay, in your back, and then bring your head back to the back, as if you were pushing on a wall or giving yourself a double chin. Bring your chin down, and then make a half circle to the right. If it's available to you, you could pull your right hand a little bit towards the right side, like pull with your, with your right arm, right hand, and then go back to center and lift your face and lift your face. In other words, like, yeah. Don't you feel it like right away?
Yeah.
Most people have pain on one side of their neck. So this I practice all day long.
It's so important. The neck is such a big deal for me. Like I teach yoga and stuff.
Mhm.
I don't know what else to do.
Yep.
It is a big deal. Like I use also for like I know it's unrelated, but neck is such an issue, even though it's not here. Like a wooden pillow that I'll put in my cervical,
Mhm.
And then I'll just roll my hand. And it helps a lot.
I use my
There's some-
roller.
or there's other materials that are softer. Like wood is very hard on the cervical.
Yeah,
Mhm. But it still works like very well.
yeah.
So you feel a difference right away.
She did that little mini session with different, that was one of the main ones that I really liked. But there's another one too, if you have time to show, if I have time to show it.
we'll keep learning from each other.
Okay.
Okay, so let's continue. Headache. And then headache, sometimes it is, who's next?
Okay.
Is it me?
Who was next?
Oh, it's me. It's me.
Oh, okay.
Headache. Regular practice of shoulder stand helps to prevent headaches and migraines, but don't do it when you actually have a headache. Twists are very helpful too, either the spine twist, lying on the back, or any of the sitting twists.
Interesting. I must be honest, I don't know about the twist for headaches, or it would have never occurred to me. But interesting that it is here. I do think shoulder stand, but it does say it's not to do when you have the headache. So it's really more, okay, what do you really do when you have a headache, right? Because like to prevent it, you can do regularly headstands or I think inversion are helpful. But if they're saying not to do it while you have a headache, what other things can you do? And for me, I would just say my experience, for me, sometimes headaches are very tied to all this, the shoulder areas, the cervical, head. So you have so much tension here that everything's tight. So I would just start working on just upper body extremities, like shoulder rolls or like head side to side, nodding the head back and forth. And even the eyes. So sometimes we get a headache because we have eye strain. So working on the eyes, anything that's in the face or like tightening the face, releasing the face. Sometimes I would even use tapping. So tapping the temples like this, even though it depends on how severe the headache is. Now let's just try this one. So close your eyes. And so close your eyes and find your temples and take a deep inhale to the nose. Exhale, sigh out through your mouth and keep tapping your temples. Just finding, and this is good for creating awareness, finding that vibration in your brain, and then start tapping all around your brain, maybe coming to the very back of your brain where your brainstem is, right where your brain meets with your spine, and just tapping that area with your fingertips. And then keep breathing in through the nose and out through your mouth. Maybe keep tapping all around your skull. Find any sore spots that you're able to find. Sorry. So finding any sore spots that you're able to find. Maybe come to your forehead and tap the center of your forehead between your eyebrows. And feel the vibration. And then slowly stop and just feel your head. And then, I mean, obviously, maybe for somebody that has an intense, I wouldn't do it. But for somebody that's just maybe even like massaging here, the temples to one side, then the temples to the other side. Things that I would use, or pressing the temples for about 20 seconds. Now inhale and then exhale. So something that I would use, or even like massage your neck, massage the back of your head. What would you guys use? Does anybody have an idea?
Well, I get maybe once or twice a year, I'll get a migraine, and it's usually related to my stomach. So I drink water, and it really helps. Drink like 3 glasses of water. Yeah. So that's just me.
Okay.
I know my headaches are always related to the stomach.
Yeah, I was about to say the
Stomach.
same thing. Whenever I have a headache, it's because I'm dehydrated.
So interesting.
So that's
uh,
usually, yeah.
Yeah, interesting that you say about the stomach because they're saying that what did it say? The twists are very related to stomach, so that makes sense.
Mhm.
And again, like our brain and digestive system are connected, right? So it definitely makes sense that if you work on one, the other one will get better. All right, let's just continue. You guys have anything to add at any point, just go ahead. So hips, who's next? I think it's this one.
Mhm.
Me? Oh. Stiff hips can cause bad backs. Try cobbler's pose and sit there for some time, leaning against the wall if necessary. Kneeling poses like virasana and inverted poses in which the hips can be worked without any weight on them can be particularly helpful for arthritis hips.
So bad back. So again, like hips are also a big issue. So kneeling poses. So I don't know if you know about Vasana. It's just basically sitting on your heels like this. Yes. And then inverted poses in which the hips can be worked without any weight on them can be particularly helpful for arthritic hips. So well, hips are a big deal. I think that hips, like just bringing mobility to the hips always helps. So anything that circles, things like that are good. A lot of people have stiff hips, right? And because they're sitting for too long, or they just don't move enough. Do you guys have any suggestions for hips that you can think of?
Every time I honestly, because my joints are very stiff most of the time. I've been working on like my own practice, and my own practice is more very gentle yoga. So I focus like from head to toe warm up, and for the hips, I usually do like the swinging very gently though, and just trying to get some mobilization there. Um, and what else do I do for it? I'm trying to think.
Yeah, so the one that they say
Yeah.
here, the cobbler pose, you guys know which one. So it's like this together and this opening, obviously the opening of the hips.
Mm-hmm.
This one. And like maybe going down and pressing down with your arms. Just feeling that hip stretch here. Another one that I find helpful myself, and then because I do have a hip issue on my left hip, is just getting this stretch of the IT bands. Sometimes it gets so tight and your glute gets so tight. So getting this stretch, and it's not easy to get as much in different poses, but this one's a really good one for me. Another one, if you're sitting on a chair, I would say just bringing like this, so bringing the foot up to your thigh, and then leaning forward with your back spring. So it's the same type of stretch, but just here. Maybe you can get or you can do it lying down as well. Like basically bringing the foot over the thigh and bringing the leg in. And that works for like piriformis syndrome, sciatica, what else? So bursitis, kinds of things.
One thing that I did when I was doing yoga therapy with Rose, she taught me how to bring the leg up here to the knee. I don't know if you guys can see me.
Okay.
And then slowly start with the hands like up to the knee here and relaxing. And as you exhale, you push a little bit, and that's just a stretch here.
Yeah.
And then you just keep going down until you get to the hip.
Interesting.
And and once you're done with this leg, you can just kind of like twist here to the side and breathe in a little bit here, and then that just helps to open more the hips.
Yeah.
Yeah, and then you can just do the other side too. I don't know if you guys want to do the other side, and then just breathe in, exhale, and push,
Yeah.
and that just opens up the hip. Yeah, I like this one a lot. This one helps me when I start with like my warm-ups on the ground.
Yeah, it's definitely good to know why the issue is happening, right? Because we can try different things and some will feel good or not. But it could be, sometimes you can be hypermobile, and hypermobility can also be bad. Or if you have too much joint mobility, then that can cause issues. So you have to work more on strengthening certain muscles, right? Other times what you really need is mobility or to stretch. So it's just finding, because it's all a balance, right? Anything that's in extreme is going to be damaging. So it's more about finding the balance. So what does this person really need? Do you need to open more? Do you have too much tightness? Do you need to strengthen, right?
So it looks like
Yeah,
all those are modifications of like pigeon pose, with one knee bent, right? I guess chair pigeon and pigeon on your back, something like that, right?
Yeah.
Oh.
Yeah, those are really good too, for sure.
And you can do like three-legged, three-legged down dog, that's a kind of an inversion that gives you a lot of room to bend your knee and rotate your hip in the air. But you could also just do that like one of the hatha warm-ups where you kind of sit like in a pigeon pose, like a half pigeon pose, and then you can like
Yeah. Yeah, even standing, you can do that one, like just bringing, like I'll do this more like warming up the brain, but just like doing this motion and then from the back forward this way. But those are definitely all very helpful. And for
those are
joints, anything that's circular motion is really really good. So good suggestion.
Okay.
Okay, so let's continue. Shoulder and neck. Who's next?
I think I am next. I think.
Go ahead, yeah.
Every shoulder and neck. Everyday use of computers, telephones, cars, and the pace and stresses of daily
I
life.
think you skipped knee problems.
Oh, knee problems. Oh yeah, I'm sorry. Yes, we did skip it. That's me. Okay, knee problems. Inverted poses are wonderful for the knees because the joints can be worked without bearing any weight. Also give a lot of time to mountain pose, learning how to stand firm and quiet and even on your feet. Sitting up straight with the legs wide apart in a pose called Upavista Konasana is also good for feeling the back of the knees open without hyperextension. You want me to continue? Shoulders and neck?
No, let's so do you guys know what upavista, which one that is? Upavista. So for knee poses, I would say, so for knee problems, so my experience, and I'll just yeah, we can read what's here, but I'll also talk about my experience. My experience with knee problems is a lot of times you really need to strengthen the muscles surrounding the knee. So the muscles that support the knee need to be strengthening. So more working towards like strengthening the lower body. And because as we get older, the first thing that fails is usually your lower body. Where is your feet or your knees or your hips, right? It's usually here. Well, obviously your neck and anything that's strain related is an issue. But because we walk on our feet most of the time, we need our feet and our lower body to get off the bed in the morning, to go to the restroom. So much we use it for. And it is so important. And knees are a huge thing. And again, sometimes there's things you can do, you cannot do, you can help it. But circular motions for knees is always helpful, and strengthening the muscles around the knees I find also helpful. And then, well, it says obviously stretching is important. So the one that they're suggesting here is Upavishra Konasana, which is basically just opening the legs wide and then slowly coming. And this is something that everybody can do. So you also have to watch out, especially if we're talking about knees, like not creating that hyperextension of the knees, right? So like the locking of the knees. So always like maybe you do it, but like bring the awareness to your knees. Try to relax the knees. Try to relax the muscles around the knees. So bringing that awareness to the area that you're trying to work on is always. So that's how you actually catch your own habits, and maybe at that moment you catch, oh, this is what I'm doing. Maybe this is what's causing the issue. Like maybe I'm gonna try to adjust a little bit, right? So just to when you bring that awareness to that area, then the own person is able to catch their own habits.
You know what I've noticed with the knees? I have a standing desk. And I actually have also a stool that I sit in. After like 2 years of working 8 hours a day, sometimes on my legs, my knees started feeling it. Okay, so a lot of people are now doing the standing desk thing, but you have to realize that the best thing to do is to change positions, not always standing, because I really feel that contributed to my knee problem. I mean, it's healing now, way better, but
What do you feel helped you the most?
changing positions, and going back to sitting and standing, changing positions, and also I have an anti-fatigue mat. I don't know if you guys, this is an anti-fatigue mat that I stand on, and it kind of bounces around. It's good for part of the day, but it also, I feel that it does this to your knees, and it's not necessarily, I mean, I use it part of the day and I sit part of the day, So that has really, I have really had experience with standing desks, and they have other problems. It's way better than sitting though, way better, but you still have to change positions. Another thing I do is like when with the standing desk, I cannot bring it all the way down to the floor, to where my feet touch the floor. So they're always kind of hanging. And I also noticed that hurt my knees. So what I did is I ended up getting something. You guys are gonna laugh at me. I ended up getting this thing, which is supposed to be for toilets, for when you're sitting on the toilet. And I put my feet in here, and guess what? The knee pain has gotten a lot better. I mean, it's just incredible. Yeah.
So you put them when you sit on your chair?
Yeah, when I sit down, I make sure that I have, I put it on that so that my knees, my feet are not hanging, because then you're pulling on your knee for hours,
Got it. Interesting.
So yeah, I've studied this a lot.
Yeah. Yeah, when you have conditions, you study them.
Yes. Yes.
That's how you help.
Well, my back used to hurt a lot when I sat for 8 hours a day. My lower back was a problem. So I ended up not, having to find a solution. But not everyone can do that,
Yeah. True. All right, so let's move on. Shoulders and neck. Also, we already talked a little bit about it, but let's just read it. I'll read it. It says, everyday use of computers, telephones, cars, and the pace and stresses of daily life cause most people to hold a lot of their tension in their neck and shoulders. Usually one side is worse than the other, so work more on the stiffer one. Cow pose, eagle pose, triangle, supine twist, forward bend onto a chair, or if you're flexible as far as your toes, child's pose, dog, I don't know what dog is, locust, and sitting forward bend are all good for this. Tight shoulders and necks muscles can contribute to headaches. So a lot of a lot of different poses, and I mean, we've already talked about this a little bit, but we could add a lot more as well. So definitely also a big deal. Let's continue. Stress. So go ahead, Ray.
So I would get this one.
Mm.
Stress.
Get your own.
Lie for backache. Breathing gently with the whole spine long and flat on the floor for at least 5 minutes. When your breathing is slow and regular, gently fold in your knees and hug them without tightening your shoulders. Child's pose is a fabulous one for stress, as are the shoulder releases like cow and eagle arms. If you are turning this into a full practice, move on to standing poses, shoulder stand, and then supine twists. Leave plenty of time at the end for long shavasana or corpse pose.
Yeah.
This is freaking true. I'll tell you that.
So which one do you use the most, so you would say, when you are stressed?
Well, for me, when I'm actually feeling very stressed, starting the way they talked about, either just lying supine or in child's pose especially, are very like, those are both very soothing. Anything where I'm kind of like, huddled in is soothing. But then also how they talked about making this into a full practice and, getting up and standing, doing a more energetic practice helps me kind of sublimate that anxiety. So turning it from anxiety into energy that I get out,
Definitely. Yeah, I think that for me as well. Like for me, when I'm stressed, I need to, it feels like there's a lot of energy inside of me that I need to let out. So high intensity works for me in those cases. Or like running, or even just dancing around with whatever favorite song.
And then also ending with that long shavasana, I think is helpful too, because I tend to skip over that in the past. But I've realized, just like in any yoga practice, meditation, pranayama, something that's very helpful for me to come back to the world and not get anxious again is to have that long extended grounding experience where I'm preparing myself for going back into the real world.
Yeah, so definitely high energy, and then continued by whether it's shavasana or like very focused slow breathing, like exhaling. Breathing is huge for
Then you train yourself how to go from that excited place back to a calm one, and that just is such a helpful tool.
Yeah, you create your own habit of self-regulating.
I like doing pranayama outside. Like if your backyard is like calm and nice, and it's like a nice fresh air, like sitting outside and doing just a little bit of pranayama meditation, even just like 10 breaths really helps. Like I feel like that clean air like helps you just to like, and then just feeling the sun, just the senses, like you feel more calm. Like I don't know about you guys, but like maybe like I had to do that yesterday. I literally left the morning and I went to the park, and I was with my friend and we played music and we just like sat and just like took some breaths, and I felt so rejuvenated afterwards. It really helps to go outside. Don't be inside all the time too when you're stressed.
What they call forest bathing. Forest bathing under the trees.
That's funny. Like I for me, just going outside is just the stepping out. It's like, oh, like it's healing. It's like, okay, I feel different. Or even just seeing the sun, or like hearing the birds. I don't know.
Touching a tree.
Hugging a tree.
Even better,
Yeah. I'm guilty of a tree hugger right here.
All right, so let's continue. What's next? So last one. Who's next? Is it, I guess, Elizabeth?
Yeah. Oh yes. It's varicose veins, headstand and shoulder stand, and other variations of these that you can do.
Yeah, so for, especially for people who stand a lot on their feet, I would say that this is helpful. Just bring the legs up, legs up, because you bring
Legs up against the wall.
legs
Yeah.
up against the wall is a great one. Like you don't need to go all the way, because the reality is, how long are you really gonna stay on a headstand? Like maybe a minute at the most. But if you can do legs up the wall, that was something that you can stay there for 5 to 10 minutes, and it's really, really helpful. Really good for circulation. Also compression. So I hear that. So compression is good. So they say compression, compressive ice is also good. Anything that prevents the circulation from accumulating in that area, basically.
I like to do like I don't have varicose veins, but what I do also, like for my joints, I did the warm up of like rotating the ankle, and then like afterward, and then just doing that a couple of times, and then massaging my leg, and that like very like not too hard, but like at the same time like really feeling the energy. Like that really helps me. Like when my legs used to hurt a lot, I do that a lot, especially in the morning, just moving the ankle and then just letting the blood flow. And then just that mindfulness that you're really, like the warm-ups with the head and the eyes, that's just bringing like more mindfulness of like you taking care of yourself. Like that's self-care right there.
Yeah. Yeah, like beyond varicose veins, I would say more like if your feet get swollen, or if if you have a lot of even leg pain from standing or whatever, anything that's like rotation of the ankles, like you said, or bringing the legs up, or if it's not on the wall, it could be even be on the chair, like the legs on the chair, like if you have an iron chair. This is helpful also for circulation.
That's another issue with standing desks, that because I noticed too that my veins started to hurt. I don't have necessarily, big varicose veins or anything, but they do hurt when I stand a long time, and mostly around the knees. Most of the veins, like in back of the knees. So definitely sitting and,
Awesome, guys. Okay, so we learned some things about some conditions, and just keep in mind, so maybe when you get into a class and they're like, oh, I feel this, or I feel that, or I have digestive issues, or whatever, you're able to maybe remember some of these.
Yeah. Oh, this is one that I will keep close.
So the other one that's very helpful, and it's called yoga. This one, it says sequences for your teaching. So I think it's for you, Belen, I think it's at the end of the chapter 6, if I'm not mistaken.
Yes,
now,
it was at the end.
Now I do want to let you know before we go into this one, I am going to tell you that there's a lot of articles here on your chapter 6 that I want you to read, right? It is important for you to go over this, and this is on your own time. The one that we read is general ailments, which are the most common, but then you're gonna find here, there's one for hands and wrists, which is also very useful. There's one for tendonitis in the biceps or upper arms. There's one article for shoulders. It's called Arm Yourself Against Injury, keeping the neck healthy. So some tips on how to modify for shoulder issues. There's another one called Neck, Keep the Neck Healthy. So again, a lot of neck issues. A spine, it's called the Lumbar Low Down Fishtail. So again, lumbar is a high prevalent issue, so we read that one. There's another one for the hips. It's on the hips. There's one for chronic pain, yoga for chronic pain. And there's one for the mind, yoga for depression. There's part 1 and part 2. And then there is menstruation, so insomnia, menstruation, and nervous system. So you have a lot of information, a lot of articles that you are gonna have to go through. Maybe I'll give you an assignment just to make sure. I don't know. Actually, I am gonna give you an assignment for next time, so that you guys can pick each one a condition, and you can do a practice. Right, that's gonna be your assignment. So write it down. You're gonna do a 25 to 30-minute practice for a specific condition. Create your own, because we do have some sequences here, but I want you to create your own. So it could be for the hips, it could be for hip pain, it could be for neck, it could be for stress. It could pretty much be for anything. Even if it's not listed here, you can do your own research. And then make sure that your practice, so it includes at least 1 or 2 pranayamas, whether it's at the beginning, at the end. It includes a centering. Always know that you need a centering. And then something that I want to point out to you that is different from like typical yoga class to yoga therapeutics class would be that you don't do as many poses. You stay longer. So you stay longer in each pose, right? So maybe you'll pick a pose and you stay there for like even like 3 to 5 minutes, or three to, let's say like 3 minutes at least. Typically we'll do like, I mean, if it's a 25-minute practice, you can maybe pick 5 or 6, 5 to 8, something like that. You have to do that many. So it's more about really getting into the pose and staying in the pose, and maybe finding the subtleties within the pose more than, okay, here, straighten your arms and bring your arm down and left arm down. So it's more about really feeling the pose and bringing your mind to the different aspects of the pose, and bringing the awareness of the breath within the aspects of the pose, if it makes sense. Right? So that's going to be your assignment for next week. And now we are going to go over this article, which is kind of long, so we'll try to make it again a little bit more dynamic. We'll just get up and do some of it, or practice some of it together. Do you all have it? Yeah, okay.
Which one is it? No.
It's called Sequences for Your Teaching. It should be the last one on the chapter 6, I believe.
Chapter 6. Sequences. No, I have yoga for anxiety and panic attacks. That's fine.
If it's in there, where do you guys have it, Rain and Elizabeth? Or I'll send it to you.
It is the very last one, but I would just look in your table of contents, Billin, and see where you can find sequences for your teaching. For me, it was the very last document.
Oh, I found it. It was not the last one. It's like in the middle.
Okay.
I don't know why.
It's 19 pages. It says
Yes.
yoga.
Yes, I got it. Thank you.
All right, so I'm gonna get started. We'll each read. I would say, and again, we'll do a page each, so one whole page. So I'm gonna start. Sequences for your teaching. We asked how we could support your teaching, and you requested sequences you could use in the studio. So here's a primer on sequencing a class, followed by 9 routines that target different types of students, areas of the body, and physical conditions. So also very helpful to keep handy. It's an article by Richard Rosen. Yoga class sequences come in different shapes and sizes. Every contemporary school, such as Iyengar, Vini Yoga, Bikram, Ashtanga, and Vinyasa, to name a few, has its own ideas about how to sequence a practice. So you may have already been trained to sequence your classes in a particular way. Most sequences are linear. That is, one posture follows another in a logical step-by-step direction, moving from less challenging to more challenging and back to less challenging. In general, a sequence like this opens with simple warm-ups that set a theme for the practice, intensifies to more challenging postures, slows to cooling postures, and ends with relaxation, Savasana or corpse pose. But this is just one way to sequence. Typically, each posture in the sequence is performed just once, but you could also have your students perform each posture 2 to 3 times, focusing on a different aspect of the posture each time. Take, for example, Trikonasana, triangle pose. I'm just gonna finish this. Focusing on the feet or legs. So you can do triangle pose, focusing on the feet or legs, then repeat it while focusing on the spine or the arms. So it's again, it's the same posture, but you're focusing on different aspects, right? You can also build the entire sequence around just one posture, like triangle, returning to it again and again, and use the other postures in the sequence to teach aspects of the main posture. It says here 9 sequences. So, okay, we're gonna see 9 sequences. So one is 45 minutes for beginners, this is beginners yoga, advanced beginners, headache, menstruation, depression, groin, shoulders, forward bends, and back bends. So, a few things for you to practice teaching, right? All right, so let's just say here's an example of a general linear sequence, right? And this is based on Iyengar. Rain, go ahead and read the sequence.
Lead or just read it through?
Yeah, just read it.
Okay, so the first is centering, which could either be a simple meditation or a breathing exercise in a seated or reclined position to help the students collect and concentrate their awareness. Then move on to preparation by teaching a few simple exercises that warm up the body in preparation for the theme or focus of the practice. You can do 3 to 10 rounds of Surya Namaskar, and then proceed to standing postures, arm balances, inversions, abdominal or arm strengthening poses, back bends, shoulder stands, twists and or forward bends, and ending in Shavasana. A full practice sequence like this would take at least 90 minutes to finish, but not all classes go quite that long. Here are 2 possible sequences, one for beginners and one for advanced beginners, that would fit nicely into a shorter time frame. So for beginners, do you want me to continue?
Yeah, go ahead.
Okay.
Do you have questions so far, anybody? I mean, that's like a typical like linear sequence. Centering, preparation, like warm up, sun salutation, standing, and with inversions, twists, and then corpse pose. Yeah, go ahead.
So this setup could be modified for beginners, starting in Sukhasana, easy pose, going into Adho Mukha Svanasana, 3 rounds of Surya Namaskar, I'm assuming, Vakrasana, tree pose, Uttita Trikonasana, extended triangle pose, Uttita Parsvakonasana, extended side angle pose, Dandasana, staff pose, Paschimottanasana, seated forward bend, Baddha Konasana, bound angle, Upavista Konasana, wide angle pose, Navasana, boat pose, Salabanasana, locust pose, Setu Bandha Sarvangasana, supported bridge pose, Vipariti Karani, legs up the wall pose, reclining twist, and Shavasana.
Okay, this is some like just a simple beginner's sequence, right? And then when you compare, so you keep reading, then there's the advanced beginning, right? And it's just basically like adding more challenge. They'll add like half moon pose. They add handstands at the level, so you start working more with the inversions on your arms. I don't know if you have any questions about these poses or these sequences. And again, you can look at them, but until you feel it in your body, you're not really gonna know. So I would say, even if you have these sequences, before you teach it, feel it in your body, like do it yourself for yourself, and then teach it. You can do as much research when you do your homework. Okay, fine, do your homework. You can, okay, all these poses are good together for headaches or for menstruation. But then take your time to do the sequence first before you teach it, because when you feel it in your body is really when you're best able to guide others. So Elizabeth, continue with the headache sequence.
Okay, headache sequence. There are many different kinds of headaches. Some like tension headaches and migraines are fairly common. Others, like sinus headaches or headaches caused by brain tumors, are relatively rare. Various treatments, including drugs, acupuncture, chiropractic, and massage, and stress relieving techniques, are recommended for dealing with headaches. Yogas, asanas, and breathing can help too, though mostly with tension type headaches. Okay. Here's a sequence you can teach to a student who is suffering from a tension headache. Whenever possible, get the student practicing soon after she starts to feel the pain. Once the headache is established, it will be very difficult to alleviate. Headache sequence. Balasana, child's pose. Have the student place her head on the floor or support her torso and head on a bolster position between her thighs. The bolster's long axis should be parallel to her torso. Total time, 3 to 5 minutes. Janu Sirasana, head to knee pose. Support her head either on a bolster laid across her extended leg, or if she's flexible, on the front edge of a padded chair seat. Hold each side for 1 to 3 minutes. Total time, 2 to 6 minutes. Adho Mukha Savasana, downward facing dog. Support her head on a bolster or block. Total 1 to 2 minutes. Uttanasana, standing forward bend. Place her head and cross forearms supported on a padded chair seat. 1 to 3 minutes. Supta Bhaktha Konasana, reclining bound angle pose. Support the torso on a rolled blanket underneath and parallel to her spine. Setubhadra Sarvagasana, supported bridge pose. Support the torso on a bolster and instruct her to let her shoulders and head rest lightly on the floor. 3 to 5 minutes. Viparita Karani, legs up the wall pose. Let her pelvis be supported either on a bolster or rolled blanket. 3 to 5 minutes. To protect her back when exiting, make sure she doesn't twist off the support. Either instruct her to slide off the support first before turning on her side. Bend her knees, press her feet against the wall, and with an inhalation, lift her pelvis off the support, then slide the support off to one side. Lower her pelvis to the floor and turn onto her side. Number 8, Shavasana, corpse pose. Ask her to take normal inhalations, but let him the exhalations as much as is comfortable. If she normally takes 5 counts on an exhalation, extend it to 7 or 8 counts if possible. At the end of the first 10 or so exhalations, pause for 2 to 5 seconds before drawing the next inhalation. This will take 10 to 15 minutes. When in corpse pose, she might also want to lay a weighted sandbag on her forehead. Have her lie in corpse and position a block so that it's touching the top of her head. Its long axis should be perpendicular to her head. lay the weighted back half of the block and half, lay the weighted back half off the block and half off the forehead. The pressure of the weight on her head helps release tension.
Yeah.
Do I continue?
No,
That was very nice.
Yeah. So as you can
For the
see,
headache.
so this is a headache, and we were talking about headaches before, but this is a headache sequence that is tension related. So it's a tension related, and it's a lot about using the bolster to relax the head on it, right? To find that sense of relaxation. It seems like a very nice, and as you can see, it's only they're only using 8 poses, right? 8 poses. They're not using that long. So here they're maybe staying like from 1 to 2 minutes, other times 3 to 5 minutes. As you can see, it takes compared to a regular yoga class or maybe a vinyasa class, you're staying a little bit longer on each pose. Basically more focusing on the details, right? Or going into the specific details or variations of the pose. You guys have any questions? All right, so let's continue with menstruation. And I guess this is you, Elizabeth. Good.
Is that me?
Elizabeth.
You want me to continue?
Yeah,
Me?
go ahead. Yeah, continue.
Okay. Okay, menstruation. Exercise during menstruation is generally highly recommended. It's believed that exercise can ease the discomfort of dysmenorrhea, quell mood swings, anxiety, and depression, and reduce bloating, which is what I suffer from a lot of bloating and the cramps. Most contemporary yoga teachers advise a fairly conservative approach toward asana practice during menstruation. These menstrual sequences generally consist of prop-supported poses, mostly forward bends. This makes perfect sense for women who feel sluggish during their cycle. However, many other women don't feel the need to change anything about their practice during menstruation, except maybe to limit strenuous inverted poses. Each student should decide for herself what kind of asana sequence is most appropriate for her body during menstruation. But here are some poses you can offer as a start. Menstruation sequence, minimum 45 minutes, maximum 60 minutes. Sutta Baddha Konasana, reclining bound ankle pose. Support the torso on a bolster, about 5 minutes. Supta Padangusthasana, reclining big toe pose. Use a strap to hold the raised leg in place. Hold each side for 2 minutes, for 4 minutes. A total of 4 minutes. Number 3, Baddha Konasana, bound ankle pose, 2 minutes. Janushirasana, head to knee pose. Support the head either on a bolster laid across or extend the leg, or if she's less flexible, on the front edge of a padded chair seat. Hold each for 3 to 5 minutes, for a total of 6 to 10 minutes. Paschimottanasana, seated forward bend, with her torso and head supported on a bolster laid across along her legs, 3 to 5 minutes. Upavishna Konasana, seated wide angle pose. Rest the torso on a bolster positioned between her legs with its long axis parallel to her torso, 3 to 5 minutes. Then have her come up and twist to each side for 30 seconds to 1 minute, holding the shin or the inside of the foot, 1 to 2 minutes. 7. Uvadhanurasana, supported on a chair. Pat the chair seat in either a sticky mat or a folded blanket. Then ask her to slide her legs into the space between the chair back and seat, and sit on the back edge of the seat facing the chair back. Have her grip the chair legs just below the chair back and with an exhalation. Leading to a back bend, the front edge of the seat should cross her back torso just under her shoulder blades. Instruct her to keep her knees bent and feet on the floor. Support the back of her head either on a bolster or a block. She can continue to hold the chair legs, stretch her arms overhead, or slip her arms underneath the seat between the chair legs and grip the back rung. Make sure she's breathing smoothly. To come up, ask her to bring the chair legs just below the chair back and pull herself up with an exhalation. Ask her to lead the movement of her torso with her chest, not her head. 3 to 5 minutes. 8. Seated twist. Still sitting, reverse to the chair.
trying to figure out this one, and I don't know if you guys.
I was gonna ask you about that one because I was trying to imagine it as I was reading.
Yeah, like I am also, I was like, okay, support on the chair, pat the chair with a seat or a sticky mouse. We're not gonna do. But then ask her to slide her legs into the space between the chair back. Oh, do this, I would say. I don't know if this is what she means. And sit on the back edge of the seat facing the chair back. Okay. Have her grip the chair legs just below the chair back. And with an exhalation, lean into a back. This is so weird. Like, I don't know exactly. Like, is this what it means? I don't know.
The front edge of the seat should cross.
Just seem a little intense for me for a illustration back then. But I don't know. I don't know if you see something different.
But it says that also to support the back of her head with either a bolster or block. But I don't know. It's
I mean, I know this is a way to
that would be too intense for me.
that would be too intense.
Yeah, I would. Yeah, and I guess all the other ones kind of warm up to this one, right? This is just like the.
Yeah. I do feel like it is a way to teach back then, right? Like using a chair, but I don't know if I would teach this for menstruation issues. Like I would just probably keep it more low, more restorative. Like maybe bridge could be, or like supported bridge is still, you're still opening. I don't know, but I don't know if I would do this one. And this is just me being here, trying to make it dynamic so that you guys can also weigh in your opinion. So, and I think about like, would I really use this for this, right? Would I use something else instead?
Yeah, it also depends on the person. They have limitations on certain, the body.
Yeah.
Like that, I wouldn't do with somebody who has like back pain. Like it would.
Yeah. The other thing that occurs to me when I have my period, I get a lot of low back pain. So I wouldn't want to put a lot of weight on the low back. I think for me, more helpful would be something like Balasana, like child's pose. Maybe even like child's pose using the bolster. I think they may use it like this. Almost feel like very nurturing, very soothing. Or like this. Right, so you're still creating a little bit of pressure, but not too much. So that would work for me. Maybe some people are so sensitive that not even that would work.
You know what? When I was giving birth to my daughter, I had an amazing nurse, and for the back pain, which is exactly the same, it's just worse when you're giving birth. You know what I mean? Push the lower back against the wall, and that really, I mean, it takes it away immediately, even in labor pains. It's amazing.
The low back against the wall, meaning?
Yeah, meaning push your lower back against the wall, kind of bend your knees a little bit and lean against the wall, or your torso against the wall, and then push with your knees up.
Like a squat? Like a
squat? No, but not like a squat, still standing, but with your knees like kind of bent a little bit, pushing with your knees against the wall, but standing, you know what I mean? Like just your knees a little bent and push the lower hip, the lower back against the wall really hard. Oh my God, It
So
really,
like the way Elizabeth's doing?
I'm trying, but it's like.
oh yeah. Okay, come down a little more, bend your knees a little more, maybe put your feet a little forward, a little forward.
Should I widen my stance?
There,
Like that?
okay, now push your back. Okay, maybe come down the wall like a couple of inches. Okay, now start pushing with your knees, pushing your lower back
Oh,
against.
I feel it. Yeah,
See?
yeah.
That
I
is,
feel the support of having like using the back heel, my feet to push back.
yes, for
Maybe if
labor
I did some
pains,
breathing.
yeah. And then make sure that your shoulders are against the wall too. Like everything against the wall, but just push them with your knees, you know, pushing your lower back against the wall. Like basically what you're doing is your tailbone. You're pushing your tailbone against the wall.
Got it.
And that's what brings the release. I mean, for labor, it literally takes away the pain. You know, this nurse was kind of crazy and she had me walking around and walking around and walking around and doing that.
Well, good to know. Well, I'll
It
use
really works. Keep it in mind, ladies.
for you guys when you.
Well, my daughter's 32, if you can imagine.
I felt my thighs and my knees engaged,
Yes.
but and I took a couple of breaths there, and after I released it, I still felt like they were engaged, but like I did feel like a little bit like just release.
Yeah.
That helped me. I was having a
Yeah, it helps. It's like magic. Amazing.
Good to know. I'm gonna do it. Okay, so let's continue. So like as far as these, I think Paschimottanasana, which is forward fold, that's fine, especially using like a bolster. Like when you're in your period, you're just want to kind of relax. So maybe even like using like this would be nice. I can see that. Jana Shisharshana is basically this one. And again, you can always use a chair. I don't know if you guys are used to using the chair. Not that I use it very often, but especially with restorative, where you're staying in the pose for a long time, it's just helpful. Like you have a blanket underneath. Okay, you're still doing the pose, so you're using the legs of the chair to keep your legs straight, bending the knees, and then keeping your spine straight is basically to stay there. And then that's how you stay like, okay, 2 minutes, and it felt like you were able to relax in the pose. And then other side, right? So this one we start using more props in these types of restorative poses, right? What else? Baddha Konasana again. So Baddha Konasana together, and again, for more restorative, like I'll use either this or the bolster or something else, right? Okay, continue.
Okay. Number 8.
Yeah.
Seated twist. Still sitting, reverse through the chair. Ask for the twist on the right with an exhalation. Hold for 30 seconds. Then twist to the left for 30 seconds. Repeat 3 times to each side. Each time holding for 30 seconds.
Yeah, so for this one, I feel like what it was saying is, so I guess you were reversed on the chair somehow. And again, I don't know if I don't think that I would include that one. Yeah, but it's just like doing a slight twist. This is fine, right? So I like twisting, looking behind you. So still a twist, but it's more gentle. And then when you stay in the pose for a few minutes, you definitely feel it. And if you're used to teaching high-paced classes like I am, it's kind of weird at the beginning to teach such slow classes, because you're like, okay, I mean, how can I really be here for 2 minutes? But you get used to it. It just depends on your style.
It's the what?
It depends on your style. Like for me, it is hard. Like I tend to teach high intensity, and then I like a balanced practice. So half of it is kind of intense, like making them at least break a little bit of a sweat, and then find that relaxation at the end. That's kind of what I like doing in my classes. But sometimes with these restorative or therapeutic classes, it feels like it's very slow, right? Because you stay longer in the courses. Like some of them were like 3 to 5 minutes, so definitely you're staying a while. But you'll start finding the rhythm for the person, and you also have to look at the person. If it's person that it's like ADHD and they cannot stay still, you're gonna have to you're gonna have to be creative, like move them or find other ways, right? Because they'll be like, is this what I'm supposed to do all the time? Like, am I supposed to be moving, right? They kind of find that peace in the pose. Okay, number 9.
Yes. Number 9, the Pradita Karani, legs up the wall pose. Support her pelvis on a bolster or rolled blanket. 5 to 10 minutes. Make sure she slides off the support before turning to her side. And then end with Shavasana, 8 to 10 minutes.
So I'm just gonna show you, and you're free to do them, or if you don't know how to do them, go ahead and ask, because this is the time to ask, right? So imagine there's the wall behind me. So this is what they're saying for this one. And here, they're actually saying that you stay for 5 to 10 minutes. That's a long time. I will sometimes use like a blanket on top of the feet to kind of create that sense of grounding, right? And just like find like maybe like a sort of meditation or relaxation or breathing within the pose, right? So this is a great time. And usually, typically, you're holding your legs against the wall, so it's pretty relaxing for the most part. Okay. All right. Okay. So next, Belen, can you read
Yes,
our next one?
yes. Depression, right?
Yeah.
Okay. The word depression covers a wide range of conditions, from long-standing and severe clinical or major depression to shorter-term and episodic mild depression, also called dysthymic disorder, to situational depression brought on by a major life change, such as the death of a spouse, job loss, divorce. Many different therapies are available for depression, including antidepressants and psychotherapy. Studies indicate that regular exercise too, including yoga, asanas, and breathing, can help some people ease the symptoms of mild to moderate forms of depression. Here is a sequence you can try with students suffering from this condition. Depression sequence, minimum time 40 minutes, maximum time 70 minutes. Supta Baddha Konasana, reclining bound angle pose.
You guys know that one? And also, if you don't, yeah. And then, so I'll just show it briefly. I don't know if we're gonna be able to show all of them, but so for this one, typically you will roll the blanket. If you can see it. So, like, it's actually very soothing, right? So you take it a long way, and I haven't done this in a while. But so Sutta Baddha is basically lying down on the ground and then feet together, right? And you can place the blanket. So some people cannot bring their legs are not, their hips are not that flexible. So you can either roll it like this and hold it. It's still very soothing. You can maybe even use another roll blanket under their cervical spine or like a little pillow if you want. So basically, it's like folding the blanket. Keeps your legs from being too a strain, or your hips from being too strained. The other way you can do it is using blocks and supporting the thighs or the knees, depending on how low they will go. But it's so basically that you can truly relax within the pose. Like still relaxing. There's other ways to place the blanket, but I typically do it that way. I don't know if I think Melinda does a different way, but anyways, just using a blanket to support your ankle. Okay, continue.
Oh. uh, Supta Parangustasana, reclining big toe pose. Ask her to use a strap to hold the raised leg in place. Hold each side for 1 to 2 minutes. Total time 2 to 4 minutes. Adko, a ver, Adho Mukha Svanasana.
Just so you know, I don't know if you know this one too, but basically Sutta, what is it? Sutta Parangustasana is basically using a strap, and I don't have a strap here right now, but using a strap to hold your leg like this and feel the stress of keeping the knee down. So it's still pretty relaxing if you're holding your leg with a strap. Like I'll use my arms if I don't have a strap. But it's
Okay. Adho Mukha Svanasana, downward facing dog. Use a bolster or block to support the head. Total time 1 to 2 minutes.
And then again, this is the same, just downward dog if you guys want to try it. Of course, you've never tried it. Like you can use like a kind of a dolphin, but it's just downward dog like this, supporting the head. Whether it's on this on one side
I
or
wonder.
the other.
Okay. What's the purpose of holding the head with the?
It's more like so that your head finds that support. It's just bringing that awareness there, and like there's something about it that is soothing, right?
Supporting, yeah.
It's
Yeah,
like
it's
feeling
not
that
like
support.
hanging.
Yeah.
Okay. All right. Uttanasana, standing forward bend. Support her head and cross forearms on padded chair seat. Total time 1 to 3 minutes. Support her head, cross forearms. Okay.
And then again, Uttanasana is just a forward fold, like a standing
Yeah.
forward.
Padded. Okay. Intermediate students should perform the full pose for a total time of 3 to 5 minutes. Ask them to bring their feet back to the floor slowly together if possible, either with a straight knees or bent, with an exhalation and standing forward bend for 30 seconds before coming up. Okay, total time 3 minutes. Okay. Urba, number 6, Urba Dhanurasana, upward bow pose. Supported on a chair, pat the chair seat with a sticky mat or folded blanket. Then ask her to slide her legs through the space between the chair back and sit on the back edge of the seat facing the chair's back. Instruct her to grip the chair legs just below the chair back. With an exhalation, lean into a back bend. That's what you were showing before?
Yeah, which again, like I'm not too sure about this one. I don't know if that's if I'm doing it correctly, but I think that the key here, and especially when we're talking about depression, is anything that's so when you see when you look at somebody that's depressed, this is what they do, right? They collapse their chest, shoulders are rounded. So really, what you want is like opening of the chest, opening of the lungs.
Okay.
So any heart openers are good for depression.
Okay. The front edge of the seat should cross her back torso just under the shoulder blades. Have her keep her knees bent and feet on the floor. Support the back of her head either on a bolster or a block. She can continue to hold the chair legs, stretch her arms overhead, or slip her arms underneath the seat between the chair legs and grip her back rung. Make sure she is breathing smoothly. To come up, ask her to grip the chair legs just below the chair back and pull herself up with an exhalation. Make sure that she leads the movements of her torso with her chest, not her head. Total time 3 to 5 minutes. Okay. Seated twist. Continue to sit reverse through the chair, then ask her to twist to the right with exhalation. Hold for 30 seconds, then twist to the left for 30 seconds. Repeat 3 times each side, okay, each time holding for 30 seconds. Total time 3 minutes. Setu Bandha Sarvangasana, bridge pose. Place a blank under the shoulders for support. Place a blanket, I suppose, under the shoulders for support. Repeat 3 times. Each time for 30 seconds to 1 minute. Total time 2 to 3 minutes. Number 9, Salamba Sarvangasana, shoulder stand. Total time 3 to 5 minutes. Follow shoulder stand with Halasana, plow pose. Intermediate students should do full plow with their feet on the floor. Beginners can do plow with their feet resting on a chair seat. Total time 1 to 2 minutes. Support the head either on a bolster laid across her extended leg, or if she's less flexible, on the front edge of a padded chair.
That is head to knee. So Genesis Sharchana, which is this one, right? It's just the same poses, but it's using props, right? So if you have any questions along with how does one go ahead and ask. We'll just try it together and just can see what it feels like, right? So that when you teach it, you already know. But it's basically we're using different props to support us during the poses. And like just going back to the depression, since we're talking about it, the twist. So a lot of the times depression comes from lack of motivation. So I don't know if you know, but in our gut produces a lot of about 50% of certain neurotransmitters like dopamine and things like that that actually help the motivation and the hormones for happiness, right? Serotonin, dopamine, and I don't remember what else, but a lot of it is produced in the guts. So anything that's gut related, even if it doesn't seem like it, it will help your brain, right? Produce those neurotransmitters. I can't hear you. I think you're muted.
Sorry, I got muted, sorry. So I was number 11, Setu Bank supported bridge. Oh, we did supported bridge pose. Number 12, Viparita Karani, legs up the wall pose. Pelvis is supported on a bolster or roll blanket. Total times 3 to 5 minutes. Ask her to slide off the support before she turns to her side. Number 13, that one is pretty simple, the legs up the wall. Number 13, reclining conqueror Ujjayi. Instruct her to lie on a blanket support to open her chest with long, smooth, full inhalation and exhalation. Total time, 3 to 5 minutes. Savasana corpse pose. Instruct her to come off her blanket support and lay her back torso flat on the floor. Support her bent knees on a bolster. Total time, 8 to 10 minutes. Groin. My dictionary notes that
Wait. So this is the end of depression. Do you guys have any questions? No. Any questions about any of the poses? Anything you want to try out or try out teaching? Okay. So let's continue. Let's just keep going with groin. So I'll do that one. My dictionary knows that the English word groins perhaps derives from the Old English groins, which means hollow. The groins are indeed hollows, located at the junctions between the thighs and pelvis. For the purposes of yoga instruction, though this is not technically correct according to anatomy textbooks, we can distinguish between the front groins and the inner groins. The front groins refer to the creases running from the hip wings, the two little bony knobs a few inches to either side of the navel, diagonally down and into the pubic bone, the front bottom of the pelvis, which together form a V. So it's basically this, right? V shape. The inner groins extend from the creases between the inner thighs and the perineum, the fleshy base of the pelvis. Any groin sequence should work with both these pairs of groins. So the inner groins extend from the creases between the inner thighs and the perineum. So you know the perineum is right between your genitals, right? So anyways, this is a groin sequence. And it begins with 3 reclining poses. So it starts with Supta, Baddha Konasana. I feel like groin sequences focus a lot on hips, hip openings, or breathing into the groin area. Sometimes even like using the muscles around, so bringing that awareness to the groin. Sometimes we're not even connected to the part of our bodies for whatever reason. So like bringing the awareness to like the the muscles like that we use for peeing or anus even. So a lot of sequences focusing on that, like retention and it, depends on the issue, right? Depends on what kind of issue you're working with. So let's see what this has to say.
Bea,
Yeah.
sorry to interrupt. I'm not really getting the inner groins. So from the creases between the inner thighs and the perineum. So I got that location, but to where? Where do they extend to?
The inner ones, yeah, like I didn't really get out. So I'm assuming this one, so the pubic bone, which you can probably find and feel, and then that's the V, right? So that's the one that I also got. The other one says it's from the creases of the inner thighs. So I would say here, right? Which for me is the same somehow. And the perineum. So the perineum would be more like inside the pelvis. So like obviously you'll find your, but I still, I would have to see a picture too. I'm sorry.
Okay. All right. Thank you.
Not really sure. Anyways, so it starts with Supta Avara Konasana with the back of her pelvis flat on the floor. Then after a minute or so, place a block under her sacrum. So, right, that little bone, you guys already know. She will eventually place the block at its highest height, but if the sensation is too intense, you can lower it. So meaning like this versus this, right? Placing it right under the sacrum like this. And just finding that awareness there of like, you kind of want to bring the awareness to that area. And sometimes it feels weird because obviously you're talking about the the genitals, but I think it's just a part of the body, right? And we're just working with it. She will eventually place the block. Okay, Supta Virasana, reclining hero pose. If she can't recline comfortably on the floor, make sure that her back torso is well supported on a bolster. Place a heavy sandbag on the front groin of the bent leg.
Oh, I don't get that. What?
So Supta, because Virasana is hero pose and Supta is reclining, so I would assume like this. So her back torso is well supported on a bolster. Place a heavy sandbag on the front groin. I'm not sure I'm getting this one. Okay. Supta Virasana. Okay, I get it. So the way it's saying is, so this one's very hard for a lot of people, especially if they have knee issues. Like just be careful. So what you want is like maybe sit like on the edge of it, and then you're gonna allow. Sometimes you will need more than one bolster, basically. But allow yourself to relax in this pose. Really like feel it feels pretty intense on the hips here.
Oh,
You can place double bolster or just grab a sandbag and because you want to keep bringing the awareness to that area, just place the sandbag on the front and just stay here for as many breaths or minutes that you want to stay. So it says here, so it says 4 to 6 minutes, which is pretty long in my opinion. But as long as the back is supported and it feels comfortable, then it's okay. So alternatively, like for somebody who has painful knees, review the instructions of, if she still finds the pose uncomfortable, have her take a low lunge at the wall as follows. Start by facing the wall, place her right big toe at the wall and slide her left knee back into low lunge. Press her hands into the wall for support. So that's a much easier variation. basically. And that's for somebody who cannot like bend their knees in that way. So bring it here and then the lunge. So you still feel a stretch here on your hip and then pressing against the wall. You can try it if you want. So it feels like the wall makes it feel like very stable. And I definitely feel that stretch there. Right? And then obviously you do both sides. Then we have Supta Parangustasana, reclining hand to big toe pose. Hold each leg vertical for 1 or 2 minutes. We already did this one. So basically, again, you're holding your leg up and you're doing the stretch and relaxing the rest of your body, finding your breath. Adho Mukha Svanasana, so downward facing dog. And here we're saying for about 1 minute, right? And then you ask to step the right leg forward to one-legged king pigeon pose. So ask her to lay her torso down on the inner front thigh for 1 to 2 minutes. Then have her step lightly back into downward dog. So one-legged king pigeon pose. I would say,
I can't see you.
I don't know, but for me, it would be this one. So basically from downward dog. Maybe you can raise it up and place the leg down and then find your. And then here you can either use again blanket postures to relax into the body. And then Prasarita Padottanasana with leg extending forward bend. This is with a variation. With the legs wide, have her bend her right knee and shift her torso to the right, snugging in against the inner thigh. A structure to keep the left leg strong, pressing the inner thigh out to the left. Hold for 1 minute. So again, it's wide-legged and standing. You guys want to do it if you need to move. Go ahead. So here you always say pigeon-toed, right? And then you can bend. It's a forward bend, so you can bend forward, you can relax. And then just saying to bend one knee and keep the other one straight. And then breathe into it. And then it says that you stay for 1 minute. That's a long time. But you can do maybe 30 seconds each time. And kind of like finding the comfort in the pose is important, right? Especially when you're keeping the hold. But then you'll stay here and you're like, okay, how are your shoulders? Are your shoulders relaxed? Is your head relaxed? Right? Are you feeling your inner groin? Well, then since we're working the groin, it's just to keep that awareness in that area. But also see what happens with the rest of your body, right? As you do it. So number 7 is Utthita Parsvakonasana. So it's just extended side angle. So these are all hip openers. And then this one, it says for 2 to 4 minutes each side. So look how different it is, right? So with Ashtanga, we hold for 5 breaths. And that's probably not even 1 minute for anyone that I know. So you're really holding. So this one is extended side angle. And again, you can use your leg to support your arm and then right arm goes up, or you can do all the way down. But then you can feel this one really deep in the hip area. Vrksasana tree pose, you already know that one, and that one's for each side for 1 minute. Upavishta Konasana, so again, we already did this one, which is the wide angle seated pose. This is all working our groin and our hips area. Jana Shastarshana, again, we already saw this one too. And here you can use a chair, you can use also a bolster to come onto the pose, basically bending one knee against the other leg. sorry, no, Jana Shushasana is horizontal. So here, again, if you're using more restorative, you can use also bolster. Or if they're flexible enough, they can stay here. Try not to round their backs. Malasana. Yeah, Malasana. Malasana is this one. This one, I feel like this is Malasana. Which is, again, you have to be careful with the knees for some people. And if they're older people, maybe not go all the way down. So maybe you can just ask them to stay here. Keeping their knees, like moving a little. And maybe you start like this, and then you ask them to go deeper. If they can, if it's accessible. You always say, you start here, you start at the lowest level, and then you take them to the deeper levels, if it's accessible to them today. Yeah. Setu Bandhasana, which is bridge pose, which we already know. And again, we can use the support. Placing a block for support. Salamba Sarvangasana, supported shoulder stand. And so for me, supported shoulder stand, there are ways to use the chair for shoulder stand. I don't use them that often, but some people use them. Like some people will come up like this, and then making sure that your chair is stable, right? You can do this. Or like you said, you guys can find a bolster and just put it underneath. Like this, sorry. Go up here. Shoulders like this, and then you can bring the legs back here. After. Anyways, and then Shavasana. Total 10 minutes. So again, just this is for me more like a hip opening sequence. So you can use, a lot of people have tips. All right, so let's continue. You guys, let's each pick a pose and teach it. Just move a little. Yeah. Okay, Rain, pick the one that you want to teach, whichever. The most challenging or your favorites.
From the groin sequence. Okay.
Oh boy.
Okay. Hold on. Alrighty. Let's do Supta Padangustasana. And I'd like to try out this block thing. That's why I picked it. So let me grab a block. Okay. So let's start by just making our way onto our backs on the mat, gently resting your spine long, and let's extend both legs. And then bring the feet together, arms by your sides, palms facing up. And now we're going to extend one leg, the right leg, up into the air, lifting it to the sky, pressing your lower back into the mat. as you lift. And here you can either you could use a strap around your foot, or you can hold behind your thigh, or maybe holding behind your calf or onto your foot, just relaxing your head down. Let's take a breath here with the right leg extended, toes flexed towards your face. And if you have a block, let's go ahead and bring it to the right side of the body. So I'm just putting it in line with my hips, about a foot away. I'm not sure how far away I need it, but we'll see. So now we're just gonna open the right leg to the side body and let it come to rest on the block. So for me, I have my block on the shorter setting and I need to turn it up to the longer setting. I could also just move it closer. Oh yeah, that feels good if I lay it down and put it really close to my hip, kind of how Bailyn had hers at first. And keep the toes flexed. You could rest your right hand on your inner thigh or your leg to press open that hip, making sure that you don't place your hand on your knee. I could also see using a strap here on your foot. Let's take 2 breaths. Exhale and bring the leg back to vertical, pulling the leg closer to your body one more time, maybe tucking the chin to your chest, reaching your head. And then exhale, slowly roll your head back down, releasing your leg to the mat, and then extending the left leg towards the sky. Flexing the toes towards your face, taking hold behind your thigh, or maybe using a strap here on your toes. And we're just gonna keep this leg vertical for now. So straight up to the sky. And then get ready with your block. Let's take 2 more breaths here with the leg vertical. And then exhale, open that left leg out to the side, resting it on your block, adjusting your block to suit your needs. And I like to keep my toes flexed, but if you'd like to relax your foot, that's okay too. Maybe taking your hand to your thigh to open through your groin a little bit more. You could even do a massage with your hand. Just gently massaging your groin and inner thigh. Let's take 1 more breath. Exhale, bringing that leg back to center. Taking hold higher up on the leg than you did the first time. Rounding the chin towards your chest, pulling the knee towards your head. And then releasing the leg down, gently rolling the spine onto the mat. Taking a deep breath. And that was it. So we can roll onto the sides or roll up in an egg-like manner. However you want to comfortably come back to seated.
That was wonderful.
Thanks. How did everyone use their blocks? Did it feel good that it helped, or do you have any? Okay.
Yeah, I used to flat like this. I kind of like put it more towards my buttocks.
Yeah.
Yeah.
Yeah, I tried both
That
ways.
flat.
I tried both ways, but flat was better. Even on the other side, I used my bolster just to notice the difference, and it also worked out.
Okay, cool.
It felt nurturing and like relaxing. Mhm.
And it makes sense, like physically, to have the bolster or the block or bolster closer to you, because then you have more gravity working in your favor for opening, I feel like.
Yeah, right. Also, I like the massaging your groin. That was, or your hip. That was nice. Like a nice addition. Mm.
Thank you.
Okay, so let's see. I guess we'll just pick for each one sequence. You guys can pick one that you can do. I mean, I wish we. I don't know if you guys have time. We're almost done. 12:30, but I wanted to finish this. This article. So let's do shoulders. Can you guys stay for like 2 more minutes? And Rain, I know your time is limited, so.
I mean, I can do like 2 more minutes, but I have a bunch of yoga stuff to do.
So what I would say is, so let's just, we can cut it here. But I want you guys to read not only, so first read the remainder of this article, right? Which is shoulders, the shoulder sequence, forward bends, and back bends, right? And then, as I said before, pick an ailment, whatever it is that you want. Maybe something that you have issues with or trouble with, because it's easier that way. Pick an ailment and create a sequence of about 30 minutes, right? Include pranayama, include physical, include maybe one meditation at the end or guided relaxation. And then next week when we meet, we will start with that. So each one is going to teach for 30 minutes. Does that make sense? Do you guys feel like this was helpful in some ways? Yeah.
Very much so, yes.
It was wonderful to go
It
through
was
all of them.
amazing.
Yeah.
And if you have any feedback or like things that we can incorporate next time, just please feel free to do it, because I mean, we're always improving, right? And we always want your feedback to see how we can do this better in a better way.
I really liked how we were reading the material together and then also to doing the poses, and how you were like spontaneously like, okay, pick a pose and teach it. I liked that a lot.
Okay, that's great.
Yeah, me too.
Okay, so let's just finish together. So let's sit cross-legged. And just for a moment, close your eyes and acknowledge yourself in this moment. And take a deep inhale through the nose. Exhale out through your mouth, and just scan your body from the top of the head down to your perineum. And bring your hands again to thumb and index together to mudra. Bring your chin slightly in so that you get a stretch in the back of your neck. Now inhale through the nose. Hold your breath in. And then let's exhale together with an Om sound. And now bring your arms all the way up, palms together, touch. Exhale, hands to the heart. Just thanking yourself for this moment, hopefully incorporating this knowledge or this wisdom into your practices. And we say namaste. And your name.
Namaste.
Dea. And namaste to each other. Thank you so much for being here, for your time, your presence.
Yeah.
And I hope to see you again next week. If you have any questions, if you need to call me, text me, anything, I'm available.
Thank you all so much.
Have a happy weekend.
Thank you guys.
Nice to see y'all. Bye.
Bye.
Bye.